Welcome to the Balance Talk Show.
So today I'm truly honored and personally so grateful to welcome someone who I have deep respect, Professor Helena Teede. Even though you are specialized in so many women health, we are only going to talk about and focus on PCOS. So let's dive into it. In a very simple word, what is PCOS?
So PCOS stands for polycystic ovary syndrome. Unfortunately, the name is incorrect. It came from a historical time where we thought women had cysts or fluid sacs on their ovary, which we now know is incorrect. What the condition is a hormone condition or an endocrine condition where many of the chemical messengers in our body are just not in balance.
Mm-hmm.
In that context, some of those hormones are out of whack or imbalanced, and that causes a whole group of symptoms. It affects our skin, acne, loss of scalp hair, increasing facial and body hair. It affects our psychological well-being. It causes anxiety, depression, impacts on quality of life more than diabetes does.
Mm-hmm.
It causes reproductive health disturbances, including putting our eggs to sleep in the ovaries when they're partly developed so they look like fluid sacs or cysts when they're not. It affects fertility, miscarriage, pregnancy health, and long-term health of mothers, babies, and the next generation. And it also affects our cardiometabolic health, so much higher risk of diabetes, high blood pressure, high cholesterol, and heart disease. It's not just a simple problem with our ovaries.
Okay, so is there any early signs that women know before they get having this PCOS?
So the problem is that 70% of people who have the condition don't get a timely diagnosis. And the reason for that is we still think of this as being reproductive or gynecological or ovary disease, and it's not, because they can present with any of those features. And in fact, the other thing that's very closely associated with this condition is that if people have a higher weight, which in our society, 65% of Australians do, that will cause manifestations of PCOS. And if you have PCOS, weight will make it worse.
So is there anything like people with a heavier weight have a PCOS, or people with a lower weight has a PCOS, or you put on weight after you get PCOS?
Both. So in other words, PCOS occurs whether or not people have higher weight. It just occurs at a lower prevalence. So less lean people get it. When people start to put on weight, they are more likely to get the symptoms. So they had a more mild form that comes through when they put on weight. But then when they get it, they're more likely to gain further weight, and that makes the condition worse.
When I talk about PCOS, I had it and I didn't know until I actually put on so much weight, and it was too late. Like, I was already obese. I had lost all my scalp hair, had facial hair, but my GP didn't diagnose that early. So by the time I realized that I have these symptoms, it was already too late. I was already overweight. So obviously lifestyle does make a difference if you can put that onto that light.
Lifestyle makes a huge difference. The challenge with that is at the moment, people are no less disciplined than their parents or grandparents were 20 or 30 years ago.
Yeah.
We just live in a sea of pretty toxic, ultra-processed food and relative physical inactivity, so that it is now really hard to be healthy. And so our environment, there are 100 countries around the world that have a sugar tax or a sugar levy. Australia does not. We have one of the highest intakes of ultra-processed food in the world. In that really toxic food environment, it is just too easy to eat badly or poorly. And then what happens is we gain weight. Over 2/3 of the population do. And with that, we bring on either the condition itself or we make it worse.
You're talking about the food. I want to ask that as well. Like, there's so many diets available for PCOS. Like, if you open the social media, there are like special pages for that. Like, go gluten-free, go dairy-free, go low carb. Like, personally, my journey is very different, but I want you to tell our audience that what is the right diet?
Okay, there is no right diet.
Exactly.
And the most important thing you have to be wary of is the social influencer who tells you about the supplements that will cure your PCOS.
Yeah.
There is not a single supplement, and I'm going to say this again, there is not a single supplement that is proven to make any clinical benefit in this condition, because as soon as it does, we make it into a medication.
Exactly.
Metformin
That's the point, yeah.
came from lavender.
Yeah.
Digoxin, which is a common drug we use, came from herbs. Once something has an effect, we turn it into a medicine and we regulate the quality of it. And I don't make a cent from anything I prescribe. So we prescribe it because it works, because it's effective, because it's evidence-based, and we warn people about the side effects. Supplements are supplements because they don't have a proven efficacy to make a difference. If they did, they would be a medication. The other thing about diet, though, is the reality is we should just be eating as healthy as we can, which means really sensible things. Lower your ultra-processed food. And ultra-processed food is food where you can't recognise the base ingredients it was made from. It doesn't look like meat and fruit and veggies and basic carbs. It looks like something completely different, and it's not made from base ingredients. Just get rid of that out of your diet. That's probably the most important thing you can do.
That's amazing.
The next thing is choose a healthy diet that is well known. The Mediterranean diet is great, but for people from your cultural background, it may be different, but really simple things. Not too much deep fried, not too much sugar. It's actually applying the really simple, not very sexy food pyramid from the National Dietary Guidelines to your cultural diet and context. And that's all you need to do. But it's not sexy and it's hard. So people go searching for a different solution. But the reality is there is none. And the real risk here is people getting restrictive with their diets. There are very few people with true gluten insensitivity.
So you mean like literally, we want to obviously say that to audience, let's not follow the trend.
No.
And doesn't matter what culture you are in, stick to the basic.
Yes, absolutely. Stick to the basics that apply to you. But again, try and get rid of that ultra-processed food. No sugar-containing drinks. That means juices and soft drink, etc. Really try and cut that back, just as a healthy thing to do for you. Then if you really are already in that higher unhealthy weight range, you need to go and see your doctor about it, because the reality is that 1 in 1,500 women, will successfully manage obesity with lifestyle alone. You are an example of that 1 in 1,500. You're an exception, but the reality is for most of us, it's very difficult. So in that context, we cannot just say, just change your lifestyle, you'll lose weight and it'll be terrific. What we say is change your lifestyle, be as healthy as you can be, and then if you need extra help, go and get it.
Sure. And is there anything to do with the body movement? Because I know so many people are busy, full-time work, mother, doing other things. Obviously, they still don't know they have a PCOS. How much body movement or exercise helps?
Massive. So I have you to help for that as my personal trainer. And I live a very busy life. I work ridiculous hours. I'm on call for the hospital. I juggle a lot of things, but I prioritise that. And for me, that's about having a personal trainer. For others, it might be something else. But essentially what we do know is, especially as we get older, resistance training is really important. Replacing fat with muscle takes all that visceral fat or tummy fat, which is really toxic and unhealthy, and it displaces it into muscle. We feel better. We're stronger, irrespective of what we actually weigh. That is really, really important for your health. And again, it's not so much about what you see on the scales. It's about knowing you're as healthy as you can be. So if you're not someone who's really into cardio or someone who really struggles to be able to motivate to go to the gym, something where you can do a regular twice a week minimum, preferably 3 times a week for 45 to 60 minutes, brilliant. But even 10-minute blocks make a difference. So what we know is anything over 10 minutes makes a difference. So park your car in the further car park away at work. Just always park it there, and you can walk that extra bit. What you do every day, what you do every week matters. And if it's just routine, it doesn't take motivation. If it's just routine, it doesn't have to cost money. If it's just what you do the way you do it, for example, people who have a set of stairs in their house, much healthier because you're up and down the stairs 4 or 5 times a day. People who have anything they can do routinely, like always parking in the corner car park and walking that extra 10
I
minutes.
remember that, like when you went on holidays, you were training in the hotel room with the tables and chairs. Like anything that works. Like it helps, right?
You can just adapt.
Exactly. Before we finish, I have one more question, which is actually quite popular in fitness industry that people are dying to try that. It's apple cider vinegar. I don't know why I'm going to ask that, but I really think that what is apple cider vinegar and why does it people think that it helps in PCOS?
There's not evidence that it specifically helps in PCOS. Fortunately, the reality is besides societal changes, which is up to the government and they need to put on their brave shoes and do something about that, making those simple choices about ultra-processed food, being as healthy as you can be, being as active as you can, seeking medical help if you need it, is the message that we need to get through, and not making people vulnerable to trying things that are actually going to be bad for their health. Because I'm legally liable for every bit of advice I give, including here.
Yeah.
An influencer has no qualifications and is not legally liable for any of it.
Here.
And they're selling things that are actually harming people.
Because we are doing it. Like so many people are doing it, especially on social media. It's the view and likes, and people believe the more follower you have, the more belief system they create, even though it's not true.
No, absolutely. And I now do a lot more social media to push back, because otherwise it's in a vacuum. So don't believe the hype. Do your homework. If you really want evidence-based advice that's been designed with and for women from all different cultures, there is a free government-funded app called Ask PCOS. It's on Google Play. It's on the App Store.
Okay.
It has all the relevant information that you need on the condition, and it's also available in multiple languages.
That's very good to know. So basic today is follow the simple diet, the basic diet, less packaged food, no sugar or less sugar, minimum sugar, less saturated fat. Keep your body on move.
Yes. Move as much as you can, and strength training is really good for you.
And don't believe the social media extra information that is not relevant. Do your own research. And apple cider vinegar, do it if you want to.
Yes, it won't harm you.
It won't harm you. And is there any final hope of message that you want to give it to our audience for PCOS that they should take care before we leave?
If you think you've got it, go and get the diagnosis. It's really important because prevention and treatment is optional. Get your information from reliable sources. Sometimes your GPs don't know as much about this condition because it was only taught for a few hours in medical school and because most of the research has been recent. But there are reputable evidence-based sources of information. Go to those groups. Verity, which is a patient group, is excellent. And the Ask PCOS app is a really good base source for information. But I think the main thing is it's a tough condition. It's really frustrating. Get someone who can empathise, listen to you and be supportive.
It does affect the mental health a lot.
It affects the mental health.
But it does affect the mental, because I was obese, I was overweight. In PCOS, I didn't know what it is and I didn't even know where to start. I didn't even know where to start. And you're just finding bits and pieces from here and there. Okay, let me try this. And you just stay in that trap. Yes. So even as you said, start with basic and you will get there. And if you have a slightest doubt, get it checked.
Yes, and the other thing about the app is you can then, most of the information you want to need is in there. Like, what is a hormone? How does it cause the condition? How do I get diagnosed? But then you can drop out your personal questions into a checklist for your doctor.
Okay, that's good.
So what do my hormone levels say and what do they mean for me? So that it allows you to have a much more educated discussion with your health professional, be it a dietitian or a doctor or what have you. So be educated, don't fall for the misinformation, and be as healthy as you can be.
I highly recommend that app to go and check it out if you have a slightest doubt. Good. So thank you so much, Helena, for sharing the knowledge. And I'm pretty sure the audience are very happy and have a little bit of hope and clearance, like what they are experiencing. Thank you so much. And for the audience, for anyone who's dealing with PCOS, your body is not broken. You just need a little bit of more information, bit more support, and you can live and feel better in your own body. Thank you so much.